Welcome to today's class. The topic today is acid etching technique. Now, acid etching technique was initially developed to improve the retention of any restoration to the enamel. Initial bonding agents did not appear to bond to the dentin. At the time, it was widely believed that dentin could not be etched as well as enamel, and acid etching of dentin would cause injury to the pulp. One reason for the low bond strength of dentin was because of the hydrophobic nature of early adhesive resins. So, in 1979, Fusyama demonstrated that dentin could be etched without causing any significant harm to the pulp. This, together with the development of hydrophilic bonding agents, significantly improved the bond strength to the dentin. The acid etching technique, together with the application of the current bonding agents, is one of the most effective ways to improve the bond and the marginal seal between the resin and the tooth. So, when you consider acid etching, the etchant, okay, so you have different steps. First you will etch, then you will apply a bonding agent, and then you place the composite. So when you consider the etch, these are basically acidic in nature, and they could be mineral, organic, or polymeric. When you consider mineral, it could be phosphoric or nitric acid. Organic could be malic acid, citric acid, and EDTA, and polymeric could be polyacrylic acid. The one what we use most commonly is phosphoric acid. The most frequently used etchant is 37% phosphoric acid. This is a very common viva question as well as a NEET question. Okay, the acid in concentration greater than 50% results in the formation of monocalcium phosphate monohydrate that reduces the further dissolution. Now, this is also very frequently asked NEET question as well as sometimes a viva question. That is, if you say that 37% produces good result, what if we can increase the amount of concentration? Then obviously the etching would be better. The acid concentration greater than 50% results in the formation of monocalcium phosphate monohydrate that reduces the dissolution. This may be supplied either okay, so this 37% phosphoric gel you can get it either in a gel form, or you can get it in a liquid form. You can get it in bottles, or you can get it in syringes. Now when you have it in liquid form, you might use an applicator or a brush to apply it. Now obviously a gel form is better because you can have a better control over the flow. Okay, so if you apply liquid, what happens? It flows all over the tooth surface. But when you get gel, you can just make sure that it just lies in the area where you want it to be etched. Another acid used is 10% malic acid, which is rarely used. So this is the etchant. So as I mentioned earlier, it can come in a gel form, which is in the syringe, or it can come in a liquid form in the bottles. So the mode of action on enamel is it creates microporosities by discrete etching of the enamel, that is selective dissolution of the enamel rod centers and the peripheries of both. So etching increases the surface area. Etched enamel has higher surface energy, allowing resin to wet the tooth surface better and penetrate into microporosities. So what happens is when you take an enamel and if you do etching, this kind of enamel gets converted to, you'll have a lot of microporosities. So because of this, the surface area of the enamel tends to increase, and the composite will go into these porosities and form what we call a, okay, so this is the composite. Okay, this will go into the porosities and it will form what we call a resin tags. So it will be like a locking mechanism. Okay, so that is how it works more on enamel, and these porosities are actually formed by dissolution of the enamel rod, either center or the peripheries, or it also involves both. So can you see how you can see all these small microporosities? So when the resin goes and gets attached to this, it will enter into all these porosities and it will form like a tag. So that will give a very good physical mechanical interlocking. So mode of action on dentin is it removes a smear layer, particularly and partially opens the dentinal tubules, provides modest etching of the intertubular dentin. Again, see, you need to keep in mind, yes, etchant works much better in enamel as compared to your dentin, because enamel has more amount of inorganic compounds as compared to dentin. Okay, dentin has a good amount of organic compounds. So this removes the smear layer, and all the dentinal tubules also it creates minor microporosities with which it goes and gets attached. Okay, like these. So can you see this dentinal tubules? Okay. So what is the procedure of acid etching? First is you clean the tooth surface, okay? Either you can do a good, that is you need to do a good scaling, and sometimes polishing is preferred with the help of pumice. And then phosphoric acid is applied on the enamel, okay? And then to the dentin, that is based on whatever kind of cavity you're preparing, let it be for orthodontic purposes or if you're doing any kind of cavity, you will apply this etchant on all the surfaces where you want the restoration to be. And then usually we'll have to give some kind of waiting time. Ideally it was 60 seconds was what was followed earlier, but nowadays evidence show that 15 seconds is sufficient, okay? The amount of effect shown in 50 seconds is same as that of amount of shown in 60 seconds. As I said, 15 seconds is more than sufficient. The etching time also depends upon the history. For example, another thing you need to keep in mind is if the patient is having some kind of fluorosis, that is high amount of fluoride content, it requires a longer etch time because the enamel is much more harder. So you require the etchant, you need some kind of time for the etchant to work through the fluorosed enamel. And also deciduous teeth requires longer period of time because they have much harder enamel. Okay, the acid along with the dissolved minerals, and then you wash off this etchant with the help of water for around 15 seconds, and then you completely dry it. On drying it, what you can see white frosty appearance, okay? This surface must be kept clean, and then what we do, you then apply something called bonding agent. After you apply bonding agent, you'll again cure this, okay? Once you cure your bonding agent, then you will place your composite. Okay, so this is the cavity prepared. Okay, you first clear the area, clean the area completely, make it dry, apply your etchant. Okay, after applying etchant, let it be for 15 seconds, then wash it out. Once you wash it out, you'll get white frosty appearance. Now, what is desiccation? Desiccation is excessive drying of dentin should be avoided. Desiccation can result in the collapse of the collagen mesh or network, which forms a dense film that is difficult to penetrate with the bonding agent. The collagen mesh is crucial for the formation of hybrid layer. Okay, so hybrid layer is a layer of, that is when you apply composite, it goes and combines with the collagen mesh of the dentin, and that particular layer is known as your hybrid layer. It is very important for the retention of your composite to your dentin. Now, in case if there is excessive desiccation, what happens is this collagen mesh tends to get collapsed. And because it gets collapsed, a good hybrid layer is not being able to form. So because of that, your retention gets affected. The monomers impregnate and become entangled with the collagen fibers of the surface demineralized dentin, creating a hybrid layer after they polymerize. The hybrid layer together with resin tags form the main prime mechanism for adhesion. Now again, this hybrid layer, this particular point is very important in case of NEET as well as your viva questions. After drying the tooth, the dentin may be remoistened with the cotton and then blotted dry. So the main steps is first you clean the tooth surface, okay, and then polish it with the help of pumice, okay, then apply the etchant, wait for 15 seconds, clean it for 15 seconds, okay, and then dry it. Once you dry it, you will get white frosty appearance. Okay, after this you apply a bonding agent. This bonding agent, you then cure it. After cure it, you place composites. Composite is again placed in layers and then cure it. So this is the whole procedure of acid etching technique. Okay, so this was initially introduced by Bunocore.